Hi, this is Dr. Bunkis. Today we're going to be inserting some pellets in a male patient. And as you can see from prior videos, it's slightly different than in a female. In a male, we have to get 3 different tracts, and I mark them with a pen before I inject. If you don't, then you can end up putting the trocar in an area that hasn't been anesthetized. And I begin by giving a little shot of local, raising a little wheel, and this part stings a little bit. And once the wheel is in, the rest is just through an area that's already been numbed up, and it really doesn't hurt very much. And like I said, the first thing we do is we inject all 3 tracts. We're just putting the pellets in a little sterile cup. I was just asked by my student why we use 3 tracts in men and only 1 in female. And that's because in men we use larger and many more pellets, and you can't clump them all in one small little opening. Now, once the pellets are ready, we're gonna get ready to wash the skin and go. But before I start, I will show you the tools that we use for the pelleting. And we use this trocar to instill the pellets. And as you can see, this will go through the skin as a solid tube. If you didn't have the centerpiece in there, the flesh would get caught in there. So we put it in with the solid little trocar. Once it is in there, we feed the pellets into this port and use this solid plunger to make the pellets stay before we pull the trocar out. Before we start, we'll wash the skin. We make an incision with a 11 blade, and this part's all been numbed up. Next, we're going to put on a little dressing, and we'll be all set. A little piece of tape holds the incision together. We ask the patients not to overdo it in the first couple of days afterwards, as far as doing sit-ups and stuff like that. But basically, they can do anything that doesn't hurt. Go ahead and peel it and help me hold it. And this is it. This is how we do pelleting at Orange County Plastic Surgery in Newport Beach, California.